I'm Paul Bunn to share the highlights of the 20th WCLC.
You may wonder why I'm here. I have gray hair. I'm one of two people that have been to all 20 World Conferences on lung cancer. Still standing. Okay, there are 4 words you need to remember. The first 2 words relate to the International Association for the Study of Lung Cancer. And those 2 words are international and multidisciplinary. The reason we're here is to take care of lung cancer, to prevent and treat lung cancer, takes many disciplines. And the organizers of this organization realized that it had to be A, international, and B, multidisciplinary. And why have we had 20 world conferences on lung cancer? 2 words, science and education. The science is unbelievable. We used to have these meetings every 3rd year. We had them every 3rd year because that's as fast as the science came in. And for education, it's based on the science, and so every 3 years was fine. Now we have over 7,500 people here a year after the last meeting, and that's because there's so much science that you just heard about to be here. But none of us can keep up on everything. I need to have education on screening, on surgery. And so there's new science and there's education. That's why we've had 20 of these world conferences. The first, there was a planning meeting in 1972. It took 6 years from the start of planning till 1978 until they had the first World Conference on Lung Cancer. And I think maybe in the next slide, there was just over 100 people. And there have been more people attending every year since then. You can see by the second one, it went up to 1,000 participants from 38 countries, and now you heard 7,500 plus from over 100 countries. So this is what I just said, international, multidisciplinary, educational sessions, scientific sessions, social gatherings. It used to be that these meetings were 4 days, and a half of the day was for social events. And now those social events, because there's so much science, get jammed into the evenings, but still this is where networking and collaborations occur. This is where there's interactions between all these disciplines and with patients, nurses, and so on. Of course, we have a lot of exhibits, hands-on sessions. Fellows come and learn, and they get awards. The Society recognizes people for its awards, and we also recognize why we're here to make things better for patients and advocates. Just a quick word on that. The 5-year survival rate for stage 4 lung cancer, which is half of the patients, was 4%. Now, you're going to see with immunotherapy, the 5-year survival is, for some is 30. For those with a lower marker, it's 15. And it's over 50% for the third of patients that have a molecular driver. So what else? The first meeting in 1978. We have 4 types of lung cancer, and they're treated differently, and they have different biology. And new scientific advances in biology change the pathologic classification. There would be no pathologic classification if it wasn't for the ISLC. You heard about the staging system. In the beginning, in 1978, staging was based on 1,000 patients from MD Anderson gathered by Clifton Mountain. Now staging is done, updated every 7 or 8 years from 100,000 patients collected by the ISLC, so people can have the right diagnosis and the right stage to allow them to have the right treatment. Some of the other things, well, this is an old slide. The staging committee started in 1997, but Rami, make sure I get that right. So, advances. This is the leading cause of cancer death in men and women. Survival rates are low, but getting much better. Screening rates. We know that screening prevents and cures lung cancer patients, both men and women. And yet uptake, even in the US, is only in 4% of patients. Surgery is way better. That's, if you had lung cancer, which hopefully no one in the room will, you'd rather have 3 little teeny incisions in your chest than a foot-long incision that breaks your ribs and damages your nerves. Radiation techniques are completely different and can also cure patients with early stages. So it's really exciting. I'm happy to be here for my 20th World Conference, and I'm sure that the advances will be in your newspapers and online in the future. Thank you.